Welcome and thank you for joining in conversation with Rashmi. So to talk about the risks and how serious things are, I have with me today a local family physician from Kitchener-Waterloo, Camala Smith. So thank you so much, Camala, for joining me in this conversation today. And we hope that, people are more educated and they understand the whole concept of how serious things can get from our conversation and discussion today. So thank you for joining me.
You're welcome. Yeah, thank you for having me.
Um, so to begin with, Camala, there seems to be this confusion about if this is a flu or is it like an influenza, but COVID-19 is nothing like it.
Yeah, so, the flu is caused by different viruses, influenza A and B, and it's usually diagnosed quite clinically by people coming down with a fever, chills, a lot of fatigue, and many other symptoms which are similar to the coronavirus. So I think that is why people sometimes get the coronavirus and the flu all in the same boat, just because a lot of the symptoms can overlap. How the coronavirus is, it's sort of a different strain of a virus, and coronaviruses actually typically cause cold-like symptoms, but this particular virus tends to lead people to quickly go into a pneumonia that's viral, which is very different from the flu, which we see that as a complication as the flu, but not in the same pattern we're seeing with the coronavirus. And this is why the ventilators and the worry about people going into critical care with this particular virus is so concerning, just because it seems to be that it starts off with this cough and fever and quickly within a span of less than 2 weeks progresses to this picture that someone could be on a ventilator or need that in order to support their lungs because of pneumonia.
Mm-hmm. And at this point, there is no vaccine or drug that treats COVID-19.
There are some promising antivirals that have shown some evidence, but none of them have been approved or studied enough to consider the standard therapy. So before we can issue anything to a large scale sort of protocol for treatment for someone, we have to make sure that drug has evidence and that the benefits of it outweigh the risk. And this is why, like some of the things that have been mentioned, the chloroquine, azithromycin, you have to also look, because there are side effects of using that combination on people, and it could lead to some problems. So there needs to be a lot more studies to kind of we can feel as clinicians that this is safe for a large span of a population as a standard treatment. So at this present moment, the only standard treatment is really supportive in nature, and everything else may be initiated. There is some evidence, but not enough for us to say, if you've got this, bang, this is the standard treatment we're going to give you.
Mm-hmm. And
does that make sense in what I'm saying there?
Absolutely.
Yeah.
And I know a lot of people are taking, malaria pills, and they're also taking Advil and stuff, loading them as a backup in case they have these flu or fever-like symptoms. Is that wise to do at this point, or
no?
Avoid it?
That's because, there are side effects, like I said, to every medication. And as you probably heard, there are people that have overdosed on this, or people who've had negative things going in and trying this. So we can't say that something is a standard treatment unless the proper evidence have come forward. And for COVID-19, unfortunately, there are some promising things. So I don't want to tell you that maybe in 2 weeks or a few months from now, something may evolve that seems more promising, but at the time, people are pretty much experimenting on themselves with these.
Mm-hmm. And what are the top most important priority right now for people to be doing to protect themselves and their families?
So yeah, that's a great question. I think, the big thing everyone has been trying to say is that social isolation is needed, because Obviously, a virus spreads by droplets that sometimes go in the air if you're close to a person. This is why we say maintain a certain distance of 6 feet, if possible, away from others. And also the surfaces that people are in, if it's their home environment, for example, will have many of these droplets. So by staying in a social circle that no one's infected, whether it's that family, group, or unit, then that just diminishes the chance of the virus jumping from one group to another. And we know that we can't eliminate it completely sometimes that way, but if we are getting cases coming in at a slower rate, then all of a sudden everybody gets this new virus in the population. It's the difference between us saving lives and not, right? Because the problem in places like Italy and other countries, all of a sudden this new virus appears and everybody's getting it almost all at once.
Mm-hmm.
And those who are susceptible and are becoming sick, they're all going to these hospitals that are not designed to host the amount of people that will become critically ill. So as physicians, you're making these really sad decisions like, oh, this person is older, less likely to make it. Maybe I'll intubate the 40-year-old instead and see how he does. This is obviously not what anybody wants to be faced with in clinical medicine. Everybody wants to think that when a patient comes in, they've done the best they can to save that patient. But if we're in a scenario where, this happens and a whole bunch of people, like an earthquake, are coming at you, this is what we fear would lead to increased mortality from this. And that's not to even count, say, for example, there's many people that are undergoing cancer treatments, that may be pregnant and needing to come to the hospital for various surgeries. We'd like to have the hospital be available for them. Because there's not only the deaths from the coronavirus or COVID-19 that would be a problem, but also all the other things that may happen that now cannot be treated with an overload of hospitals. And we can't sort of manufacture physicians or healthcare workers, right? This is a years of training and we expected a certain capacity. And so when things get overwhelming with the amount of people having infections, we're seeing not only deaths that could be preventable happening, but deaths also in our healthcare workers, right, who have a higher exposure to the virus.
Absolutely. And this stream of virus that's going on is not just, initially there was this whole debate about, okay, only if you're 60, 70, 80, it could affect you. But now even 30-year-olds, 10-year-olds, 25, it's across the spectrum. So anyone could get infected by this, and there's no real defining age group or age limit where it hits you.
Yeah, so obviously, the more comorbid conditions you have, like if you have a chronic respiratory condition or a chronic cardiac condition, the more things you have and you're older, you're more vulnerable. So a higher percentage of these people will succumb to the virus if they catch it. But it doesn't mean that if you're young and you think, everything is healthy, that you're completely immune, because we have seen that shock when people see, 30-year-olds, no other comorbidities, end up in ICU with this and some passing away, right? So it doesn't make you immune. Certainly it lowers your odds of, being the one that gets the complications, but it doesn't make you immune. Yes.
And if someone who's affected by COVID-19 and has recovered from it, is it possible that they can get it again, or is their body immune to that particular virus?
So that is going to be an emerging kind of study, I would say. But, technically our bodies, when we've had a virus for a period of time, and we don't know how long that will be. For COVID-19, it could be, months to years. We do have these protective antibodies that we form. So someone who's recovered is much more likely to not succumb if we were to put them, say, back into a clinical setting that the virus has happened. That's for sure, but we don't know how long that protection lasts for right now at this moment. But we do know, yes, in general, this is how the body overcomes viruses by forming its antibodies, and how long those antibodies will last in our system. That's an evolving study for this particular virus, because it varies. And that's why you see in the population, we offer certain booster vaccines for individual, because it doesn't mean that, oh, I've got it once, when I'm 70 and this thing comes back again, I'm not going to get it again. That's not true.
Okay. Yeah. And which one's better, hand washing or hand sanitizers? There seems to be a mixed opinion.
Yeah, always we say hand washing, because hand washing also will remove a lot of soil things that hand sanitizers can't, right? So both are effective, but if I had the choice of one, and I could do one, the 20 seconds of hand washing with soap is considered probably the best standard in terms of even other bacteria that may have ended on your skin, or it's just way more superior. But if you can't do that, then in between, I think the hand sanitizers are a good idea.
Mm-hmm. So what other suggestions could you give us to kind of flatten this curve, and collectively as a community, not just in Canada, Ontario, but around the world, we can all do to help ourselves?
Yeah. So like, I think generally you're getting at the point that we can't all just stay indoors all day if we'd like. What else can we do when we're out and about in the community? And I think one of the case thing is maintain a distance of at least 6 feet from a person if possible. So if you're walking or in contact, it's good to give that person some space, because when you breathe, of course, you're breathing out some droplets, which if someone is close enough to you can transmit the virus, right? So giving them some personal space when you're out is important. There are some epidemiologists or studies that are asking the question, why is this virus controlled more in places like Taiwan that are closer to China and Czech Republic, and which is in Europe but not having. And many are saying these places, people are making their own face masks. So anything that sort of covers your spreading of the germs by droplet via your breathing out, or others droplets coming to you, perhaps will decrease the risk of transmission. The challenge with that is here in Canada, and this is one of the things I just wanted to harp on, we're having a challenge as physicians with retaining personal protective equipment. And that includes like a mask, face shields, gloves, and in some cases, coverage for your hair as well as your clothing. And a lot of that has to do with, as the media created sort of a pandemic feel to everything, many people, ran out and bought a whole bunch of like masks and things, and they've had it like sort of stored in their basement. I mean, they're not definitely coming up with cases, but we're having a challenge even at the hospital level to retain those gears. Some physicians have said patients, while they were seeing patients in their private practice, they turned the other way and the patients kind of stole some of the masks and ran out, because everyone is thinking, oh, I got to get something. But I think that, we have to be mindful of that and remember that your chances are going to be much less if you're at home and socially isolated than a healthcare worker that has to leave the comfort of their home and their family. And so things like masks, we really should try, if possible. The hospitals are taking donations. So if you do have, a box of 20 in your basement that you were just saving around for doomsday, now is the time to kind of offer that to your local hospitals, because just because of how fast everything occurred and how global it is, you can imagine how many countries are fighting over this personal protective equipment at the moment, right? Yeah. No one could imagine the situation going on in America at present, and in Europe. And so there's a lot of fighting about who's this going to go through, and everything has skyrocketed in price, right, for you to own these things. But if the healthcare workers, are not able to get the personal protective equipment, that may mean many of them may become sick or quarantined, which means less people there when you need them, right? So I think that I just want to hop on this point. If you do have, some surgical mask or N95 mask, and it's just lying around your basement, in protection of your hospital system and your own healthcare, you probably want to donate that.
Mhm.
And try as possible to wear maybe something homemade or something to cover your face if you're in public. That may help reduce the transmission.
And where can people donate these? Is there a place, a website that?
So currently, like at the Cambridge Hospital, where I have hospital privileges, I know that they've said, like, if you basically call the hospital line and ask for someone of the administrators that is patient, they can tell you, because they all are setting up like even websites to try to process these donations, because it is they are actually quite fearful of running out of personal protective equipment under the immense stress we are right now to get this going, and all across the world, not just here in Canada.
Mm-hmm. Kamala, in terms of the older generation, they seem to be the ones that are getting affected the most with isolation and self-isolating themselves. So can you talk a little bit about what you've been hearing?
Yeah, so it is very nice for us to say, go ahead and stay at home and do your bit for this cause. But there are also some other things that have become apparent with this social isolation. And one of them is that, some people are commenting that there is an increase in suicides as a result of the social isolation, because that does a number on people with mental health and depression already. And even though our elderly population already feels isolated, this means of sort of further isolating them makes them kind of feel more hopeless. And I think suicide may seem like an alternative out for many of them who are suffering with mental health, as well as this added component of fear. So I would encourage, like, if you know an elderly person in your circle that might be living on their own, this is a good time to phone them and reach out to them, as well as offering to do little errands, like going to buy them groceries or something that they may feel a little bit more apprehensive about at this time. I also think that there's a need for us to also check in with families that there is some problems, because we know that kids are staying at home now, and kids sometimes are in a very abusive homes. And with the added financial pressures of people being laid off at their house right now because companies are not pulling the same income, then this is going to be very difficult for some families. So we have to up our advocacy for all those groups. So just keep in mind that this is going to be a very difficult time for many families, and with the added stressors, a lot of vulnerable individuals, whether they're older or children in abusive situations, this may increase their risk. So we have to be mindful and watch our neighbors' backs as a community through this time.
And you also brought up another interesting point about, people financially who don't have that kind of financial support as well, even youngsters who get, laid off from jobs. And at this point, it's not a work from home option.
Right.
How is that working with the whole stay at home concept?
Yeah, I do think that it's difficult because for the first time, people are actually at home when they're getting these emails that, you're laid off. And not only that, you're expected to stay at home where you can't go out and meet and network and find maybe other possibilities if you're been laid off. And so it's feeling just hopeless for a lot of people. And you can imagine how that would drive suicidal ideation and thoughts in already vulnerable individuals. So I think this is why, we would hoping to flatten the curve as soon as possible, because we also need to have people feel hope again and feel connected again to each other.
So one other last question I want to touch upon is, what is the criteria for testing if a person has COVID-19 or not? Is there a set criteria?
There is, and by public health, but again, that might be changing. But presently, they're testing definitely those who have traveled and have symptoms and returned, and those who are having a definite contact that is positive with COVID, and they're also experiencing symptoms. But the other testing in just general, if I'm just feeling like generally fevery, or they're not taking all those cases, because we have to remember that influenza is still going around, right? And many other illnesses that cause us to have fever and other things are still going around. But we do know that that criteria may begin to change as we're seeing more community spread of the disease. But initially, that was what they were, sorry about that. That was what they were trying to, you know, isolate these cases that were travel related, these cases that were COVID positive, contact related. And now as we get into more community spread, the criteria may change, but we're still trying to track those cases from a public health standpoint. So I do think that criteria may be updated as the spread becomes community, but I remember those were the cases they wanted sort of referred onwards. And obviously, they are testing anyone who presents to the hospital with serious respiratory status and has a fever to see if those cases are positive as well. Yeah.
Great. Thank you so much, Camala. This is some great information and great tips and points you've mentioned that people can follow and listen and adhere to. So thank you so much for being a part of this conversation and giving us some great information that we can work on and also pass on what's needed to the community and the hospitals around. So thank you.
Thank you. Thank you for having me.